Hello class, this is examination 8, video review. What best describes a chronic disease? What portion of the deaths in the United States every year are caused by cardiovascular disease and cancer? If someone smokes a pack of cigarettes a day, is inactive, and has poor dietary intake, what chronic diseases is she at risk, or is he at risk for developing? If someone smokes, lacks physical activity, and poor diet, and only decides to change one of the behaviors, which one would have the biggest impact on reducing their risk for developing a chronic disease? As of 2008, what chronic disease has more than doubled over the previous 15 years? If a 60-year-old male is obese and physically inactive, and he was recently diagnosed with diabetes, but is not taking supplemental insulin, what type of diabetes does he likely have? What is diabetes associated with in terms of complications? If someone has high blood pressure, high blood glucose, and low levels of good cholesterol, what diagnosis would the physician most likely give? If you recall Andrew's story in the chapter, by exercising and following a healthy diet, Andrew is reducing his risk for what? Cardiovascular disease is the leading cause of adult mortality in the United States, causing how many deaths? Deoxygenated blood enters the heart via how? And then blood travels back to the heart how? What type of cardiovascular disease is responsible for the most deaths in the United States? And which of the following factors may damage the inner lining of the arteries? Smoking, certain types of infections, high blood pressure, or are more than one answer correct? Hardened and ruptured artery plaque may result in what? What factors contribute to healthy blood pressure? If someone has a blood pressure of 120/80, what is this classified as? Depending on the severity of coronary heart disease can cause what type of short-term and long-term problems? Which of the following is the most dangerous form of arrhythmia? Fibrillation, myocardial infarction, bradycardia, or tachycardia? A TIA is a milder form of what? It's important for Ariana to take all her prescribed antibiotics for strep throat so it doesn't lead to congestive heart failure, rheumatic heart disease, atherosclerosis, or ischemic strokes. If someone was injected with a radioactive substance to see how blood flowed through their arteries, what test is this? What are considered healthy heart foods? And what is the association between dental health and cardiovascular disease? What behaviors can reduce a person's risk for cardiovascular disease? And what are the inherent links to cardiovascular disease in terms of genetics? What hormone appears to be a protective effect against heart disease? The challenges our bodies face in defending cells against mutations include some people, other features of their DNA diminish their body's ability to protect and repair cells, or the frequency of the encounter with the carcinogen can overwhelm the body's defenses, or the body's defenses become inactive in response to the carcinogen, or some are more severe than the body can fix. Which of those best fits the challenges our bodies face in defending cells against mutations? Include all of the following except which? When cancer metastasizes, what does this mean? The genetic link that is associated with the risk for cancer can be attributed to what reasons? Hormone levels strongly influence this type of cancer in women. What strategies for lowering cancer risk will also lower a person's risk for cardiovascular disease? If a woman tests positive for human papillomavirus, she may be at an increased risk for what type of cancer? What are ways doctors can look for signs of cancer? What type of tests or patterns or markers? What cancer is most associated with sun exposure? If someone has light skin that burns easily, what type of problem will she face or he face down the road? And what will or will not increase their risk for skin cancer? What is the deadliest form of skin cancer? What are the risk factors for lung cancer? What can smoking also increase a risk for in terms of cancers besides lung cancer? What is true about lung cancer in terms of chest pain, or smokers versus non-smokers, or being exposed to radon, or early detection? What can increase or decrease a person's risk for colon cancer? Regarding pancreatic cancer, what is true, and what is true about testicular cancer, ovarian cancer, and breast cancer? What are the newer treatments for cancer rely upon? What is the equivalent of a 12-ounce beer with regards to a shot of hard liquor and wine? Where is most alcohol metabolized? Does heavy drinking increase a woman's risk for being a victim of sexual assault? And that concludes the examination review for number 8. Best of luck.